A study on how the coronavirus travels through the body has big implications on everything from wearing a mask to a potential vaccine. Let's connect the dots. The University of North Carolina, Chapel Hill did the research. What it found was COVID-19 likes the nose. The findings suggest the virus tends to infect the nasal cavity first, where it finds cells it likes for replicating. Then in some cases it travels further in the respiratory tract where it does not replicate quite so easily, but can still infect the lungs, leading to potentially fatal pneumonia. So what does this mean? First up, we should all be wearing masks and wearing them properly. That means over the nose. With so much coronavirus in the nasal passages, covering the nose is the first line of defense. It also means a vaccine given by a shot might not be the best approach. Instead, a nasal vaccine would potentially be more effective. According to the New York Times, there are several research teams in the United States, Canada, and the Netherlands working on nasal coronavirus vaccines, but they are harder to develop and likely won't be in the first round of vaccines that make it to the market.